Hello, my name is Dr. Dewan S. Raja. Today I will discuss about coronary steal syndrome. Coronary steal syndrome occurs when there is an imbalance in blood flow distribution within the heart muscle due to certain conditions such as coronary artery disease or vascular abnormalities. So some part of the myocardium get more blood flow and the other part get less blood flow because blood is stolen by the healthy part. Coronary artery stenosis: if there is a blockage or narrowing in one of the coronary arteries or its branches, the blood flow to a certain region of the brain of the heart muscle may be reduced. Blood moves away from the ischemic region of the myocardium and diverts towards the unobstructed region with less resistant arterioles of the heart. In the ischemic part, usually there will be high pressure in the arterioles. In the healthy part, there is less pressure in the arterioles. This is because blood will naturally follow the path of least resistance. Okay, so blood will divert it towards the healthy part of the myocardium. Symptoms and possible complication depending on the severity of location of the steal phenomenon or coronary steal syndrome. Symptoms like myocardial ischemia, chest pain or angina, shortness of breath, myocardial infarction, heart attack may be possible. Then we learn drug-induced coronary steal syndrome. Sometimes drug is used to test the coronary circulation. The stress test, pharmacological stress test by dipyridamole. These are coronary vasodilator, work on the small branches of the coronary artery better than that of the major artery in our body, like that of the aorta or its main branches. If one coronary artery is significantly occluded, the coronary blood flow is diverted to the opened vessels. Okay, open vessels in the healthy part of the myocardium that has less resistance, less atherosclerotic chains, less pressure in the arterioles. This causes a steal syndrome away from the stenotic or occluded coronary vessel, that is, the vascular dilation steals the blood from the ischemic areas and diverts it to the open, dilated coronary vessels. Caution must be taken, however, because this can precipitate angina or myocardial infarction. Because of coronary steal syndrome, blood is diverting towards the healthy side, keeping the unhealthy site or ischemic site lack of blood supply. So this test by dipyridamole is discouraged nowadays. Caution must be taken, however, because this can precipitate angina or myocardial infarction. Intravenous aminophylline can reverse the effect of dipyridamole. So intravenous aminophylline is an antidote for dipyridamole. But aminophylline itself has some adverse effect. As a physician, we must know that part. But this can be an antidote for dipyridamole. Adenosine works similar to dipyridamole. Adenosine has very short acting. It's a short acting medication. Duration of action is very short, so it is preferable than that of dipyridamole. Actually, dipyridamole is broken to form adenosine. That adenosine work we can use directly the adenosine in lieu of or instead of dipyridamole. Okay, coronary steal phenomenon. What happened? Blood flow in coronary artery disease. Suppose here is the blockage by atheromatous plaque. What will happen? There will be less blood flow. They have shown it by broken arrow. Okay, less blood flow. And as a compensating mechanism, the ischemic part blood vessel, although they have more resistance, that will attempt to dilate to get more blood to keep the healthy, to keep the tissue, myocardial tissue alive. So there will be compensatory dilatation. Okay, and there is some blood flow diversion through the collateral circulation. We have to remember that collateral circulation in the heart is poor. These are called functional end arteries. So this is not very sufficient, but still due to ischemic condition, there will be collateral circulation like this. Okay, but in case of stress, any stress like the pharmacological stress like vasodilator, physical exercise, overexertion, what will happen? This, if we use, like suppose we use dipyridamole, then blood vessel will be dilated. The healthy part, more dilation, okay, than that of the unhealthy part, and blood flow will go more to the healthy part, small coronary blood vessel, than that of the obstructed coronary vascular area. And collateral circulation will disappear. Idea is that always blood flow in the area in the direction of the less resistance, less pressure. Here there is less pressure, less resistance, blood will flow in this way, no collateral, and this will come to a shorter. Okay, in case of stress, pharmacological stress, physical stress. So one of the main treatment of myocardial infarction or heart attack is complete bed rest that can manage some collateral circulation. Okay. Management of coronary steal syndrome typically involves treating the underlying cause of reduced blood flow, such as coronary artery disease. This might involve medication to improve blood flow, lifestyle changes, or in some cases, intravenous, or in some cases, intervention like angioplasty or coronary artery bypass grafting to improve the blood flow to the affected areas of the heart. So, we may use this way, intervention like angioplasty or coronary artery bypass grafting to improve blood flow to affected areas of the heart. And that's all about coronary steal syndrome. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe. Have a nice, wonderful and blessed day. Bye now.